Welcome back to our Integrative Women's Health Program. And this course, today's topic will be on delayed menstruation. Again, delayed menstruation is one of the main conditions within the menstrual irregularities. And there are many different reasons for it. And I'm going to start with a case that is a typical case that presented by one of my master teacher, Dr. Wang Ziyu. This is a 29 years old female, delayed menstruation for 14 years. She's married and she's been trying to get pregnant for 2 years at the same time. She menarched at 15 years old, and in fact is basically since 15 years old, her period's always been early. And her period runs about 3 to 5 day flow, so it's not too unusual. And she has a 32-day to a 60-day cycle, fluctuating quite a bit. She also have used clomiphene citrate in the last 3 cycles without being able to get pregnant. And the last period she had moderate amount of flow. The flow is bright red. There's some clots, but not severely. There's no pain. There's really no significant breast tenderness. The tongue is dark red. The coating is somewhat yellow, greasy in the middle. Pulse is thin, wiry. The pelvic exam is normal, except her uterus is a little small. And so this is kind of like a typical case in Asia, in China, where that a woman can have such delayed cycles since menarche. Now, delayed menstruation refers to when menstruation is 7 or more days later than the usual period cycle. And it occurs from 2 or more consecutive cycles. Sometimes menstruation can be delayed up to 6 months. And if we look into our historical documentation in the classical text, such a book as 经规要略, it basically says, in the first definition, it defines the condition of delayed menstruation in that book. And then in 锦约全书 on chapter 38, it describes the etiology and treatment of actually heat in the blood causing delayed menstruation. And later on in another textbook of the 女科切要, it also talks about etiologies of delayed menstruation as blood deficiency, coldness in the blood, and stasis conditions. So what are the known causes of delayed menstruation? Well, first of all, you should always check for pregnancy. Women can be pregnant, so that's always the first thing you want to rule out. Stress, strain, stress, injury, trauma can all delay menstruation. Major changes in the weight, it could be weight loss, could be even weight gain. A lot of time you could have delayed menstruation, or a sudden, vigorous, excessive exercise and activity can also cause weight change, and that in turn can cause changes in the menstrual cycle and cause delayed menstruation. Thyroid irregularity, if there's a thyroid dysfunction, that can cause delayed menstruation. Not at least a huge topic of PCOS, polycystic ovarian syndrome patients can also have delayed menstruation. Birth control pill usage. Some people, when you do a birth control pill usage, could be that when you're on the birth control pill, you're pretty normal, but when you come off it, you start to delay. So sometimes you can see that. Also, chronic illness. People who have chronic illnesses, such as celiac disease, can also have delayed menstruation. And not at least, some people who have premature menopause, their period is starting to delay and delay and delay. And so those are kind of possible risk factors to delay menstruation. In Chinese medicine, there's basically 5 etiologies, basically 3 deficiency etiology and 2 excess type of etiology. First is your kidney deficiency, second is your blood deficiency, third is your deficient coal, and then fourth is excessive coal, excess coal, and the fifth is the qi stasis. If we look at closely in the situation of kidney qi deficiency, we are looking at maybe overstraining and excessive pregnancies, such as miscarriages. This can all damage in the kidney. When the kidney is damaged, kidney qi is weakened, blood might be weakened, essence might be depleted. When they're deficient, this can actually delay the menstrual cycle. Or you could have spleen deficiency situation where that there's a lack of transformation of food essence and nutrients, and this then therefore is a nutritional disorder. This is where that if there are diseases or pregnancies, excessive pregnancy or miscarriages or abortions, this can cause quite a bit of loss of blood. And with that loss of blood, the yin blood is deficient, therefore the period is going to be delayed. Or that you might have emotional traumas or emotional strain that basically causes some yang deficiency, and that chronic deficiency can invite cold congestions, and that can also create this condition by causing delayed menstruation. So if we look at etiology of excess type of etiology, we are looking at exogenous cold invasion, excessive intake of cold foods. These cold pathogens can cause stagnancy of the blood. And when the blood flow is not so smooth, it's going to be sluggish, and that's going to cause delayed menstruation. Or that if you have chronic depression and excessive worrying, stagnant qi can cause stagnant blood. Again, that stagnancy blood, the flow of blood is going to be sluggish, therefore the menstruation is going to be delayed. Now let's take a look at pathology. We have kidney deficiency, we have blood deficiency. These two deficiencies can all cause basically essence and weakness of the blood. Without weakness, we cannot nourish the Cong and Ren properly. And when you cannot do that, the sea of blood becomes empty or not filled in time. And when that occurs, you're going to have delayed menstruation. Or that you can have qi stasis with coldness in the blood. These two, especially coldness in the blood, whether it's deficient cold and excess cold, both can cause delayed blood flow. The qi stasis also causes delayed blood flow. In that delayed blood flow, Cong and Ren become blocked. When the Cong and Ren channel become blocked, the sea of blood is not filled in time. It's empty or partially filled, and so the period will be delayed. So, by looking in summary, you're going to have etiology, you're going to be having cold pathogen issues, you're going to have some emotional factors, and you're going to have some nutritional factors, and you're going to add into constitutional factors, which we are looking at some kidney deficiencies, blood deficiencies, deficient cold, excess cold, as well as a qi stasis situation. And these 5 things, either they cause depletion or weakness in the filling of the Cong Ren channel, or that you have basically blockage or sluggish flow of the sea of blood, the Cong and Ren channel. Therefore, you have delayed menstruation. So the major symptoms are usually menstruation that is 7 or more days late for 2 or 3 consecutive cycles. And some of the minor symptoms, there may be changes in menstrual flow amount. There may be changes in clots or cramp when you have a delayed menstruation. Otherwise, if you look at pelvic exam, a lot of time it's a normal ovary, normal uterus size. Maybe the uterus will appear a little smaller. And looking at the basal temperature chart, you're going to have 3 scenarios. You're going to have a situation where there is a delayed ovulation. There's going to be a scenario of a normal ovulation time. There's going to be the third scenario where that is no ovulation at all. It's monophasic throughout. And so those are the three scenarios that you might see. When we're differentiating, there are differences between delayed menstruation, early pregnancy, and pregnancy bleeding. Obviously, pregnancy, beta SCG will be positive. So we don't consider as a condition of delayed menstruation. Delayed menstruation is just a symptom here. Or pregnancy bleeding. A lot of times someone's pregnant and it's delayed, and you could still have some normal bleeding. So always, when you have delayed menstruation, always make sure that the patient is not pregnant, and before you embark on treatment, and especially intervening treatment, if you have to activate the blood, might be a good idea to double check to make sure the patient's not pregnant during this time. So in kidney deficiency situation, the color of the flow is going to be darker and pale. It's going to be thin, viscous, and there's going to be sore back and weak knee situation. In a blood deficiency, you're going to be lightheadedness, you're going to have vertigo, you're going to have some palpitation situations. And in the deficiency cold situation, you're going to have some desire of warmth, and you're going to have aversion to cold. And there may be some intermittent abdominal pain and discomforts, and a lot of time the color of the menstrual flow is much more pale, much more watery and light. And when you have the excess type of cold conditions, now you're going to have more abdominal cold type of pain, and there's going to be more aversion to pressure. And usually this situation, besides a delayed menstruation, you're going to have more scanty menstruation. In a chi stasis situation, you're going to have more breast distension, more bloatings, and more abdominal distension, more than pain. That's basically some of the differences among these 5 syndromes. So basically in the treatment principle, we want to tonify what is deficient. We want to sedate what is excess. So therefore in deficiency syndrome such as kidney situation, we want to tonify kidney. Blood situation, we want to nourish blood. When you have deficient cold, we want to warm up the channel and nourish the blood. And in excess syndrome, we want to circulate qi and relieve stagnancy. And if you have combination syndrome, we want to try to differentiate the primary and secondary and treat both at the same time. And careful not to use very strong, pungent and dry herbs or blood-breaking herbs, especially for deficient cold conditions. So these 5 syndromes, again in summary: kidney deficiency, blood deficiency, coldness in the blood, basically deficient cold and excess cold, and chi stasis are the 5 major syndromes of delayed menstruation. So in kidney deficiency, we normally want to use Dangui Di Huang Yin, which is a combination of Dangui, Shou Di, Sanyao, Du Zhong, Niu Xi, Sanzhu Yu, and Zhi Gan Cao. This formula is used for kidney deficiency, and especially when you have lower back pains. And this comes out of complete work of Jin Yue, or what we call Jin Yue Quan Su. And in particular, this is what has been designed to use for the kidney deficiency, lower back pain. And this herbal formula has been utilized in this particular condition of delayed menstruation due to kidney deficiency. So if there are combination symptoms of such as lower jiao deficient cold, we can add some Ro Gui into the mix. If we have very strong deficient cold, then we want to probably add some Fu Zi into the mix. If we have a turbid leukorrhea, and we should probably add Jin Yin Zi or Po Gu Zi. If qi is deficient, we want to add Ren Shen, Gou Ji Zi into the mix. So now let's go on to blood deficiency. Again, blood deficiency in a delayed menstruation situation, usually you're going to have more scanty, pale, red flow, thin flow, There might be pelvic intermittent aches or vertigo, palpitation, lack of sleep, pale face, sallow face, tongue is pale, pulse is thin, weak. In this situation, we want to tonify blood and qi, trying to regulate menstruation. So we want to try to use a formula called 大补元健. 大补元健. 大补元健 is a combination of 人参三药, 熟地、杜仲、当归、山茱萸、枸杞子 and 炙甘草. If this patient have lack of appetite or loose stool or indigestion, we can add some 白术, attractive lotus, 扁豆, as well as 砂仁 into the mix. Now, in a cold blood deficiency cold condition, we're going to have delayed menstruation, scanty flow, pale red or watery flow, thin flow, abdominal ache, liking warmth and pressure on the abdomen, sore back, fatigue, long clear urination, loose stool. Usually tongue is going to be pale, coding is going to be thin, white, and the pulse is going to be delayed, deep, or thin, weak. So in this situation, we want to assist yang, disperse cold, and regulate menstruation. A perfect formula for this situation would be 温经汤 coming out of 金匮要论. 温经汤 coming out of 金匮要论. As you know, the main herb in 温经汤 in 金匮要略 is basically 吴茱萸, an interior warming herb, Fructus evodia, a wonderful interior warming herb. So that's 吴茱萸、当归、白芍、川芎、桂枝、生姜、丹皮、半夏、麦冬、人参、阿胶 and 甘草. And if there's a stronger coldness and aversion to cold, we can add some 补骨枝, such thing as 八极田补骨枝 and 仙灵皮 into the mix. So let's move forward to cold in the blood, excess type of cold condition. In this situation, you're going to have delayed menstruation, scanty flow usually, dark flow. There are going to be some clots. There's going to be pelvic cold pain, aversion to pressure, but better with warmth, aversion to cold, cold extremities. We are going to have bluish, white facial complexion. Tongue is going to be dark, pale. Coding is going to be white, and the pulse is going to be deep and tight. So we want to warm up the channel, disperse cold, and regulate menstruation in this situation. So a formula, same thing, we're going to use 温经汤 again, but this one coming from 妇科良方, okay? 妇人良方. Basically, it's a combination of 当归、川芎、白芍、桂枝、丹皮、二竹、人参、甘草 and 牛膝. Very, very different from 温经汤 from the 金匮. So this is a 良方 温经汤. If there's excessive menstrual flow, get rid of 二竹 and 牛膝. Let's add some 泡姜 and 艾叶 into the mix. Next condition is qi stasis, where you're going to have delayed menstruation, scanty or normal amount of flow, usually deep red flow with some moderate clots. There's some pelvic distending pain, depressive effect. There will be premenstrual breast tenderness and pain. Tongue is pink or red. Coating is thin white or thin yellow, and pulse is wiry or wiry rapid. So in this situation, we want to circulate qi, relieve stasis, and regulate menstruation. So we will use 乌药汤, 乌药汤. It's a very simple formula, and there's only a few herbs. Basically, 乌药, 香附, 木香, 当归, and 甘草. If there's a scanty flow with clots, we can add some 川芎 and 丹参 into the mix. Now we're going to be looking into acupuncture treatments with delayed menstruation. So in kidney deficiency, we can use points such as bladder 23, governing vessel 4, kidney 3, conception vessel 4, stomach 36, spleen 6. This is usually with tonification or with moxibustion. With blood deficiency, we can use conception vessel 6, 4, as well as stomach 29, conception vessel 3, spleen 6, and stomach 36. Again, we can do tonification or with moxibustion. Now, in the cold in the blood and deficiency cold type, we can use conception vessel 4, 6, stomach 29. We can do spleen A. We can do spleen 6. We can use stomach 36. These points can be very helpful. And again, we can use tonification methods or with moxibustion. Now, cold in the blood of a excess type, we want to break things up a little bit. We can still use the same points, but this time we can add bladder 32, we can add stomach 25 into the mix, but our method is not going to be tonification now. We're going to do more sedation method, and we can still use moxibustion. Qi stasis situation, we'll use spleen 4, pericardium 6, liver 3, spleen 6, spleen A, and spleen 10 are some of the common points used in qi stasis. Sedation method, and usually we don't use moxa in this situation. We can also utilize auricular points such as ovary, such as uterus, such as kidney and endocrine points. We can embed it, or we can needle, or we can do some electrical stimulation. So going back to the case we talked about from Dr. Wang Zhi of a 29-year-old who has a delayed menstruation for 14 years, married and trying to get pregnant for 2 years. This is a case of a kidney deficiency with a delayed menstruation, a primary infertility since she never been pregnant before. So what Dr. Wang has decided to do was to tonify kidney, nourish blood, to replenish the essence, to facilitate pregnancy using a modified 四物汤 type of formula. So he will use 当归, 生地熟地 both, 赤芍白芍 both, 川芎续断, 菟丝子8几天, 紫河车, 紫石英, 艾叶, 山药, 首乌, and 肉桂. So you can see there's actually quite a bit of very strong kidney tonics as well as blood tonic into the mix. 7 bags, 1 bag daily, and come back for more visit to have a minor modification. So after about 7 visits, she actually had a regular cycle and she actually achieved pregnancy. Dr. Wang is older now. He's born in 1921. He is the chief TCM physician, OBGYN gynecology, OBGYN department in Dongzhimen Hospital, which is an affiliated teaching hospital of Beijing University of TCM. He is very reputable for his work in menopause, dysmenorrhea, and endometriosis, and I'm fortunate to be able to learn from him. Thank you very much for your attention to this talk, and I look forward to see you next time. Welcome back. Today, our topic is on irregular menstrual cycle. And this is part of the Integrative Women's Health Program. A typical case, Dr. Wang Mianzi, a professor in China, had presented a case of 32-year-old having irregular menstrual cycle for several years. And along with that, she also exhibits dizziness, restlessness, poor sleep, pelvis is cold to the touch, there's leukorrhea, her back is sore, chest tightness, there's some hypochondria tightness, has used Chinese herbs focused on pacifying the liver, activating the blood, but there seems to be no relief. And further aggravate the symptoms while the cycle is still irregular. The pulse is wiry. The left twin position is small. the right position is deep, the tongue is pale, and the coating is white, thin white. So that's kind of like a typical case of an irregular menstrual cycle. Frequently, besides menstrual cycle irregularity, a lot of time you're going to see a lot of liver chi stasis symptoms. But in this case, it doesn't seem like the chi stasis herbs that help to relieve chi stasis work in this situation. So we'll take a look at what Dr. Wang does in this case at the end of our session here. So the definition is that of irregular menstrual cycles, menstruation occur either earlier or later than 7 days for 2 to 3 consecutive cycles. And from the classics of complete book of Jin Yue Quan Su, we originally called this a deranged menstruation. And later on in Dr. Hu Qinzu's gynecology, he basically said that irregular menstruation is really due to liver kidney disharmony and stagnation, and should use a formula called Din Jin Tang to soothe the liver, soothe and strengthen this kidney qi, and to tonify both the liver and kidney essence to treat this condition. So what are the known causes of irregular menstruation, irregular menstrual cycles? Well, it's similar to early menstruation as well, delayed menstruation, such as adolescence, uncontrolled diabetes, eating disorders, hyperthyroid, hypothyroid, hyperprolactinemia, medications such as anti-epileptic drugs or antipsychotic drugs, perimenopause or premature ovarian insufficiencies, polycystic ovarian syndromes, even pregnancy itself can start to create irregularity in that particular time, and not the least stress and travel. So if we look at etiology, the Chinese medicine are really big on emotional stagnation. A lot of times when there's emotional trauma or emotional stagnation, especially anger, can injure the liver. And when the liver is injured, the liver qi is deranged. And in that particular situation, the patency of flow start to become dysfunctional, and that can cause sea of the blood dysfunction. So the flow is kind of weird and unstable, so we get this irregular cycle. Then the other etiology is the kidney qi insufficiency. And this could be chronic, this could be constitutional, and this could be major illnesses that cause injury to the kidney. And this is where you have weakened the kidney qi. And when you have a weakened kidney qi, you're going to have dysfunction of regulation of Chong and Ren channel. So the feeling of this sea of blood is not stable. Sometimes feels nicely, sometimes doesn't feel nicely. So you can cause sea of blood dysfunction. So these are the two main etiologies to this condition. So again, emotional factors, constitutional factors can all cause this liver qi stasis as well as kidney deficiency. And one affects the patency flow, and one affects the dysfunction in storage, and both cause tonal irregularity, sea of blood irregularity, and causes irregular menstrual cycle. So the diagnosis usually is a definition of irregular cycle is basically when is early or delayed greater than 7 days and 3 consecutive cycles. And menstrual flow can be normal in this situation, and uterus can be normal size or maybe slightly smaller. And there could be not many other symptoms. And if this is something that's been going on for a while, we need to take a look at whether or not there are causes that we are not seeing. Now, if you have irregular menstrual cycle, that's only a few days apart. That may not be too much of an issue. But when you start talking about 7 days apart, there is definitely some dysfunction here that we need to take a look at. So we're going to differentiate between liver stasis and kidney deficiency, and a combination of liver stasis and kidney deficiency. In liver stasis, the blood flow quantity may be more or less dark flow and frequently or with clots, there is usually abdominal distension and bloating. There's chest distension, and the pulse is usually wiry. In kidney deficiency, the quantity is usually less. There's pale flow, minimal clots, lower back soreness, and the tongue is usually pale, and the pulse is usually thin and weak. And in a combination syndrome, this is where the quantity can be more or less, dark or pale flow or with clots. There's usually abdominal distension, chest distension, hypochondrial distension, lower back pain, pulse is usually wiry and thin. So the treatment in liver qi stasis, we want to circulate qi, pacify liver, and regulate menstruation. In kidney deficiency, we want to tonify kidney and regulate menstruation. In a combination syndrome, liver stasis and kidney deficiency, we want to pacify liver, tonify kidney, and regulate menstruation. So if we look at the herbal treatment for liver stasis, usually we would use xiaoyaosan as a base. So you might want to use this particular formula or modify such to treat this condition. And xiaoyaosan, as you know, is a combination of caihu, dangui, baisao, baizu, fuling, bohe, and senjiang. Very widely used formula. And if you have clots, you may want to add dansen, salvia in there, yimu cao, neonori, xianghu, saiperi, and yuanhu into the mix. In a kidney deficiency situation, we may want to use formula such as gu yin jian. And gu yin jian is a combination of 2狮子, 熟地, 三茱萸, 人参, 山药, 炙甘草, 五味子, and 远志. We can add 杜仲 and 续断 if there is stronger or more severe lower back pain. Now, in a combination syndrome, we usually would use Dr. Fu Qinzu's very famous formula called 定金汤. This is a formula that pacifying liver and at the same time strengthen the liver and the kidney in essence. 8 herbs, beautiful, well-composed formula. To this day, many physicians, TCM, OBGYN professionals love to use Dr. Fu Qinzu's formula. And it's actually very important for us professionals to really read his book. His formulas are small quantity in his formula, but it does work really well. Anyway, this formula, 定金汤, is composed of 柴胡, 荆芥, 当归, 白芍, 山药, 茯苓, 菟丝子, and 熟地. So you have basically 柴胡, 荆芥, 当归, 白芍, pacifying the liver. Then you have the 山药, 茯苓, 菟丝子, 熟地, helping to strengthen the kidney. 茯苓there kind of help to strengthen the spleen. 菟丝子, 熟地, obviously, for the kidney. So it's a wonderful formula put together for this combination syndrome of liver stasis and kidney deficiency. Now, it's very important to focus on other management, focuses on other things such as emotional management. A lot of times there's some emotional component, so we need to counsel the patient and look at how we can help the patient to become more emotionally stable. Second, we need to also look at the stress level. Take a look at what we can do to guide and counsel our patients to manage their stress better. Give them proper tools, give them proper techniques that they can learn to manage their own stress and reduce stress, and also trying to find a source of stress and trying to see if we can eliminate that. Third is sleep. Sleep really helps one to really recover. So we want to take a look at how is the patient sleeping, and also look at the sleep hygiene and whether or not this patient has proper sleep on a regular basis. And also really focus on eliminating or reducing time zone change travel. I have patients that has irregular menstrual cycle because she travels excessively, especially going across time zone. And that can really throw your circadian rhythm off and your endocrine system off, and that can cause a lot of irregularities. So in summary, in liver qi stasis, we want to use 逍遥散. In kidney deficiency, we want to use 固阴间. In combination syndrome of liver stasis and kidney deficiency, we want to use 定金汤. So let's look at the acupuncture treatments. In the liver stasis, we can use bladder 18, liver 14 point, conception vessel 3, liver 3, spleen 6, and we will use a sedation method in this situation. Now in kidney deficiency, we want to use conception 6, spleen 6, bladder 23, bladder 20, stomach 36, kidney 8, and we want to use tonification method or even with moxibustion. Now, if we have a combination syndrome, we can mix and match some of these points. I personally like to use conception vessel 6, liver 3, conception vessel 3, spleen 6, stomach 36, pericardium 6, and I would probably do an even method in an acupuncture technique. So going back to this case of irregular menstrual cycle by Dr. Wang Mianzi, this 32-year-old irregular menstrual cycle for several years. She exhibits dizziness, restlessness, poor sleep, pelvic cold to the touch, leukorrhea, sore back, chest is tight, hypochondria tightness, has used Chinese herb focus on pacifying liver, activating blood with no relief, but further aggravation of these symptoms. Pulse is wiry, left chin is small, the right side is deep, tongue is pale, coding is white. Obviously, if you look at this, definitely this is not just a liver qi stasis, probably a combination syndrome of liver and kidney issue, as well as blood deficiency issue. So Dr. Wang diagnosed this patient as a blood deficiency liver stasis, and he believed in this situation, blood deficiency is the cause and liver stasis is the manifestation. So while this patient has been using liver circulating pacifying herbs only, this does not help because the cause was never treated. In fact, it made the condition worse. So what he wants to do in this situation was to nourish blood as the primary treatment principle, and regulate liver would be kind of like within itself, still under primary, but is more secondary under the main treatment. And in the second treatment, he wants to also strengthen the spleen and warm up the kidney. So in his formulation, he devised a formula of 生地、当归、赤芍、白芍、柴胡、川念子、白术、茯苓、酸枣仁 to help with sleep, 炙远志 to help with sleep, 陈皮、仙人皮、红花、杜仲、丹皮. So you can see there's some kidney tonics, there's some stuff to strengthen spleen, there's a lot of stuff that circulates qi, pacifying liver, but also strengthen the blood. 7 bags, 1 bag each daily. And on the second visit, the patient comes back, the dizziness decreased, sleep better, there's less chest and hypochondriac distension, emotions are better, less leukorrhea, pulse is softer and less wiry, tongue coating is, the root is peeled, and liver stasis is decreased, but the in blood is still deficient. And the mother of liver is kidney. Therefore, he decided, we call it 以癸同源. He decided that let's get rid of the 红花, get rid of the 远志, get rid of 陈皮 and 杜仲. Let's add more kidney tonic in there. 熟地, 枸杞子, 怀牛膝, 党参, 制香附, and 生姜 into the mix. So prescribe 10 bags of tea for her, 1 bag every day, and have her come back, and her condition completely recover, her period become completely regular, and her symptoms are all gone. Dr. Wang Mianzi, unfortunately, is not with us today anymore. He was born in 1923, deceased 2009. He is a 19th generation practitioner of TCM in his family. Extraordinary educator. In fact, if you note our formula books in Chinese as well as some is translated into English, was written by this particular professor, Dr. Wang Mianzi. Very reputable, especially his focus and his strength has been differentiation of syndrome and any kind of writing in formulations. So thank you very much for spending time with me today on irregular menstrual cycle, and I will look forward to see you next time.